Modern medicine largely relies on pharmaceutical drugs to treat diseases. However, despite the success of pharmaceutical drugs, there remain challenges for successful treatment. Therefore, patients need alternative treatment paradigms.
The impact of neural interfaces we felt really strongly in the prosthetics market. At the moment, there are millions of people suffering from amputations or, for example, stroke or paralysis. And the NerveRepack project is targeting them to help improve their lives. And this is coordinated by the Romanian National Institute for Research and Development in Microtechnologies, along with 27 partners in total. In terms of concrete results, the 3 core outcomes of the NerveRepack project are to develop a prosthesis for forearm amputees, which connects with a neural interface, and 2 exoskeletons for patients with paralysis, either single side or both side affected, also connected with a neural interface. What we're trying to do is to develop neural implants and wirelessly interconnect them with exoprostheses and exoskeletons so that users of these exoprostheses and exoskeletons can have an intuitive experience, and hopefully this will improve the lives of millions of people across the world in the long run. The role of IZM in this project is to coat the implantable module with a very thin coating that protects from water, salt, and the immune response. The target is for the implant to survive in the body for years or even decades. The saline environment of the body can induce corrosion in the device if it's not protected correctly. This can lead to device failure and risk the safety of the patient. On the other hand, the immune response from the patient's tissue can lead to encapsulation of the device and reduced effectiveness. Our thin film packaging must be biocompatible to mitigate the risks of immune response and also be watertight to prevent the onset of corrosion. Therefore, our packaging strategy must mitigate these risks to ensure long-term durability in the body.
Fraunhofer IZM uses a single tool to deposit Parylene C and ceramic layers, preventing contamination from transferring samples between machines. Parylene C offers Class 6 biocompatibility, low water permeability, and excellent insulating properties, deposited at room temperature. The process starts with a diamond powder form, which heats and cracks into monomers that condense into a polymer on all surfaces in the chamber. For ceramics like aluminum oxide and titanium oxide, atomic layers deposition is used to create precise, alternating layers of metal and oxygen. To ensure good adhesion, oxygen plasma and saline treatments are used. During the project NerveRepack, these coatings will be tested for stability in wet environments, biocompatibility, and cell cultures before being used in human subjects. Typically, devices use hermetic housing made of titanium or ceramic. However, these housings are large and inflexible, posing challenges for high precision integration with fine and soft nerve tissue. Our approach involves thin film coatings which are thinner than a hair and add almost nothing to the implant's total volume. We combine ceramic and polymer layers. Ceramics provide a hermetic stable barrier in the body but are hard and brittle. Polymers are flexible, soft and stable but absorb water and ions. The goal is to harness the best of both materials. Our multi-layer approach uses ceramics to block water movement and polymers to provide flexibility. Inevitably, defects such as cracks or pinholes may occur, so we ensure the polymer and ceramic layers are alternating and ensure the polymer layers is thick enough to act as a mechanical buffer to prevent defects from propagating and to create a long path for potential water ingress. In the long term, this project aims to enhance the quality of life for millions with amputated or paralyzed limbs, fostering greater social and financial independence.